What's going on, everybody? Welcome back to my channel. If you're new to my channel, my name is Dr. Tom Walters and I'm an orthopedic physical therapist. In today's video, I'm going to show you a partner manual therapy technique you can use if your partner is experiencing pain in the glute region, specifically related to the piriformis muscle, and also if they're having sciatic nerve symptoms. So if they're having pain that's going from their buttock down the back of their leg through their hamstring region, maybe even to into their calf and foot. We're going to look at a soft tissue or massage technique for the piriformis muscle right where the sciatic nerve is located that often helps reduce pain. So what you're going to do to start this technique is first we want to find the sciatic nerve and that piriformis muscle. So you're going to find a bone right out here on the side of the hip. This is called the greater trochanter. It's part of our femur, this long thigh bone. First you're going to find that bump, and then what you're going to do is go in a line straight across over to kind of the tailbone, the sacrum. Now, right about in between, kind of halfway in between those two areas is where the piriformis and the sciatic nerve are going to be located. So the piriformis muscle is going to run all the way across. The sciatic nerve is going to be running from the nerve branches in the low back down through this region in the buttock and then down between the hamstring muscles. This is often a tender point for people, kind of right in between those two areas, those two bony landmarks. So what you're going to do is find that area right there, and then we're going to use our elbow really gently to kind of massage. Now, a lot of times when people see me use my elbow, they think I'm pushing really hard, but I'm just going to barely put weight on her glute region, and I'm going to kind of hunt around until she tells me that she feels kind of an area of increased tenderness or pain. Once I find that, I can kind of support myself on the table or bed, wherever you're performing this, with the other arm. That way, I don't want all my weight into my elbow because this can be pretty tender for people. So put most of your weight in your other arm and then just kind of push down gently to their tolerance. So you want this to, create a little bit of discomfort, but the person should describe it as sort of a hurts good, a therapeutic type pressure. You aren't trying to kill the person. It definitely shouldn't be more than a 3 out of 10. It should just be kind of a mild discomfort. A lot of times people will say that it feels good. It feels like something's being released, that you're working on an area that needs the work. So just kind of hunt around that area and find that tender point that feels like it reproduces some of their symptoms. In some cases, it'll even send some kind of nerve symptoms down the leg if they are experiencing sciatica. Now what you can do is another option here is once you're holding this spot, if they seem to be tolerating that well, then you can grab their ankle on the same side, bend their knee, and then rotate their hip joint in and out through internal and external rotation. And usually what the person will say is that as you're rotating the leg, they'll feel points where they experience more tenderness, particularly when you're rotating their foot in, which causes their hip to go into external rotation. So you're just going to kind of go back and forth like this, just nice and slow. If this creates way too much pain, it really increases their sensitivity, then just go back to having their leg down. And again, you can just hold, find spots of tenderness, maybe hold for 10 to 20 seconds, and then go to a new area. You don't want to hold too long because you are putting some pressure on the nerve. And if you keep pressure on for too long, it cuts the blood flow down to the nerve. So just hold for maybe 10 to 20 seconds. Again, you can grab the ankle, sort of mobilize, kind of add what's called a mobilization with movement, where you're going back and forth like this. And typically, I'll spend somewhere around 3 to 5 minutes working on an area like this. You don't want to do too much, especially if it's their first time with a technique like this, because some people get a little flared up from this. So no more than 5 minutes, just kind of work through this region. And again, that can help to reduce pain related to piriformis syndrome. Sometimes people have pain related to their piriformis muscle, or the sciatic nerve, which runs underneath the piriformis muscle and again can cause nerve symptoms down the back of the leg, into the calf, into the front of the shin, and even the foot. So give that a try. If you have any questions, put them down in the comments section. Thanks for checking out today's video. I hope you find this technique to be helpful. I will also link a video here for my piriformis video, which shows stretches and exercises you can do on your own. Also, if you need a more comprehensive program, in my book, Rehab Science, which is available through Amazon and Barnes & Noble, in the hip chapter, you'll find this piriformis nerve pain program. So this program, like all the programs in the book, is going to take you through 3 phases and have pictures of me doing all of the exercises. The programs are more comprehensive than my YouTube videos and are similar to what you'd get if you came to see me in physical therapy. The book has programs for the entire body. Each body region has its own chapter. Essentially, it lets you do your own physical therapy at home. If you'd like to get a copy of the book, I will put an Amazon link down in the description below the video. Thanks again for checking out today's video. I'll see you in the next one. Bye.